Hi guys, welcome to Virtual U Days. So sorry you can't be here with us. I'm Carrie Firestone and I'm the Associate Dean for the School of
Hi
Nursing.
everyone.
Hi guys.
Hey guys.
My name is Vicky and I'm a sophomore in the nursing program at Walla Walla University.
My name is Sophie Sherwin.
My name is Ronald Cameron. I'm a senior nursing student at Walla Walla University on the Portland campus.
Hi, I'm Haley, and I'm from Spokane, Washington. I'm currently a sophomore nursing student here at Walla Walla University. I'm sad you guys aren't able to come to our campus and experience firsthand what it's like to be a nursing student.
So why should you come here to Walla Walla for nursing? Well, first of all, because we're the best. We have the best faculty, the best students, and we give you the best experience we can. You get to know your instructors one-on-one. We're here in the Nursing Skills Lab. You'll get to know this room very well. We staff it with our faculty almost every day of the week where you can come in and get that extra help that you might need. So when you're a student here and you're here in our lab, you spend a lot of time learning things. Things like we teach you how to do IVs, we teach you how to do injections, we teach you how to start catheters, we teach you how to take care of wounds, so doing wound dressing and wound care. And then you learn other basics like personal hygiene, how to help transfer a patient when they're unable to walk, maybe get from bed to the wheelchair. We teach you how to give meds, you learn all about pharmacology, and you learn an in-depth head-to-toe physical assessment. So Wilfred, how we use Wilfred is we can use him to simulate a lot of different kind of health conditions. So as you're learning to be a nurse and we're talking about things like physical assessment and health assessment, you're going to be practicing on each other. So you have relatively healthy students you're learning on. So we can use Wilfred to simulate the abnormals. So he can respond to the treatment you're giving. So we can tell you whether or not you're doing a good job. So we can simulate things that go wrong with his heart, with his lungs, with his GI system. And then you as a nurse has to assess, figure out what's wrong with him, and then do an intervention. And so that you can see in real time whether or not what you're doing is actually making a difference. So you'll learn how to really fully assess and think like a nurse and put those skills into action once you start getting out into our local facilities and working with live patients.
It was a super exciting quarter because we got to get out of lab and practice everything we learned first quarter in a nursing home. So I got to take vitals on actual patients now, and I got to shadow a nurse and watch her give meds and watch her insert catheters.
So one of the biggest questions that we get is, wait a minute, you have a Portland campus, how does that work? So when you're a nursing student here at Walla Walla, you start here on our College Place campus. You'll spend your first 2 years here.
The first year, your freshman year, you will complete prereqs in order to be accepted into our program.
Anatomy and physiology,
General sociology, college writing,
and psychology,
humanities, art, history, courses like that.
Your sophomore year is when you become an official nursing student and you begin nursing coursework.
You begin to dive more into what it means to be a nursing student and how to think like a nurse.
After that, after your sophomore year here, you'd automatically transfer to our Portland campus. So why do we send you to Portland? Well, our campus is located right next to the Adventist Hospital there, and there is much more clinical availability. We can immerse you right into the clinical world. We have 2 level 1 trauma centers where you can learn ICU and ER, and we have 2 children's hospitals if you're interested in pediatrics. And then there's a multitude of other hospitals where we can really just get you in there, get you on the front lines, and really get you comfortable and ready for clinical care.
I was fortunate enough to receive my clinical placement in the second largest ER in Oregon. It's a 58-bed ER. It was big. You see a wide variety of patients, conditions. You learn how to treat, manage, and intervene with critical patients. It also forces you to stay fresh on your skills. That way you can master them, become good, and provide the best care for your patients.
So when you're a Walla Walla graduate, you can go and do almost anything. Our graduates currently are everywhere. We are hearing on a day-to-day basis that they are on the front lines of this coronavirus, working in the ICUs. We have graduates that are working on Mercy hospital ships that are going around the world providing to care. We have flight nurses. We have NICU nurses. We have nurses that are working in public health, helping make the decisions that are coming down to each one of us and how we live our day-to-day lives as we deal with this current outbreak.
What I love about nursing school is that everything you learn in lecture and in class and from the textbook, you learn how to do it hands-on in clinicals. It cements into your brain. It shows you why and how you're doing what you're doing. Our instructors and professor are amazing at always making sure you are keeping on track and you're understanding. They will always take time to talk with you, to pray with you, and simply just to hang out. They put your academic success and needs at top priority.
My favorite thing about the nursing program at Walla Walla University is definitely the faculty. They're all amazing. They have so much knowledge. They support their students in every way they can. They are loving, kind, and caring, of course, because they're all nurses, obviously.
I recently switched to nursing and I was pretty nervous about coming in because I didn't know what to expect, but just the way that I was received by everyone in the nursing program and the way that professors and faculty helped me through that transition process was super, super comforting because I felt as though I was making a huge jump and they were able to calm me down and give me tangible advice and just really helped me understand what it meant to become a nursing major and what I needed to do, the steps I needed to take, and I feel like I wasn't left in the dark. And so that's one thing I really appreciate about the nursing program is that we have an amazing faculty and staff.
I feel like they've made us feel so comfortable around them. We're like a big, happy family, and I feel like I can just come forward with any questions that I have. I can just text any of them and be like, hey, I don't understand this, or how do I do this? Or I can even just pop up at their office at any random hour and none of them would care. So it's just amazing knowing that I have people who believe in me and who are there for me along this crazy ride.
Come and talk to us. Come talk to one of our advisors. Come check out our lab. We'll even let you come and shadow a day in the lab and see what we actually do. Because sometimes we're on the fence whether or not we actually want to do nursing, and the best way is to really come and connect with us and let us show you what we're able to offer you here.
So yeah, I hope to see you around and have a good day.